All right, welcome back. This is Dr. Jin Sung, and today is Tuesday at 12:30, and we're going to go into part 2 of fibromyalgia. So, I offered last week for the people to take advantage of a complimentary 10-minute phone consultation with me in order to discover if we have an issue that we can help you with. Okay, so I'd like you to take advantage of that. My phone number is 978-688-6999. Give us a call and we can set up that complimentary 10-minute phone consultation for you. Okay, now today we're going to finish up some of the topics about fibromyalgia. So last week we talked about gut dysfunction, unstable blood sugar, adrenals, thyroid, anemia, chronic infection or chronic inflammation, autoimmune disease, poor mitochondrial function, and even hormonal imbalance that can be triggers for fibromyalgia. So oftentimes people are confused as to why they have generalized pain and fatigue. They don't understand what is going on with them, and they go from doctor to doctor trying to understand how to rectify their fatigue and pain. So let's get into it a little bit. Number one, gut dysfunction. In my office, we often start with the gut because the gut is the place where your digestion, absorption, neurotransmitter function, immune function, it all lies within the GI tract. So it's important to restore gut function. So if you have, let's say, an H. pylori infection, you've had a lot of antibiotics, you have reflux disease, you have loose stool or diarrhea, or you're constipated and you don't go to the bathroom for 3 to 4 days, it's problematic because your gut needs to eliminate all the foods that you take in, right? At one point or another, you have to be able to get it out of your system. So gut dysfunction, SIBO, or small intestinal bowel overgrowth, Crohn's disease, celiac disease, all these things can create havoc in terms of how nutrient is being absorbed, and it can create inflammation. So in order to test properly for gut dysfunction, oftentimes we run a stool analysis. So a stool analysis will give us a picture as to how the stomach is doing or the GI tract is doing. Do we have an infection? Do we have a virus? Do we have a parasite? Right? Do we have inflammation going on, something called calprotectant? Do we have maybe an allergic reaction or gluten sensitivity? That can all be tracked through a simple stool analysis. If we have a lot of gas and bloating, sometimes we'll do a breath test to see if you have something called SIBO. Sometimes you can find H. pylori on a breath test. So you must identify the infection, if there is one, and identify what is wrong in the GI tract in order to rectify it, right? So proper testing is crucial in order to figure this out, okay? Number two, unstable blood sugar. There are a lot of people who are insulin resistant or diabetic here in the United States. If you have diabetes or unstable blood sugar, it's going to increase inflammation, it's going to increase weight gain, blood pressure, increase cardiovascular disease, decrease testosterone in men, and increase testosterone in women. So unstable blood sugar will create inflammation, and then this ebb and flow of cortisol that follows with this insulin surges will cause problems with energy and fatigue. You need stable blood sugar in order for your brain to function. Like I said last week, fibromyalgia is not just an issue with muscle or muscle pain. It's an issue with the nervous system. Your nervous system has to fire correctly in order to function, in order to provide the impulses to the nerves to function and then into the musculature, okay? So you need proper brain function. And unstable blood sugar is going to affect that. It's going to affect short-term memory, It's going to affect fatigue levels. So it's very crucial to get the unstable blood sugar managed. On the flip side to that is the hypoglycemics, the people who have low blood sugar, right? Their fasting morning sugar might be like 56. Your brain runs on glucose or sugar, and if you have unstable or low blood sugar or hypoglycemia, you are going to get anxious, you're going to get angry, you're going to get very fatigued if you do not eat, and you feel better after a meal. So that managing blood sugar is crucial, right? So it's very simple. Eliminate those refined sugars and carbohydrates. Take in good lean protein, vegetables, and small amounts of fruit in order to get a little bit of sugar to fuel the brain. But oftentimes we will use something called a ketogenic diet or AIP diet in order to manage some of these conditions, okay? Number 3, adrenals. Your adrenals sit on top of the kidneys. It's like a little hat on top of the kidneys. And it produces multiple hormones, but the one we're going to talk about today is cortisol. Cortisol is a stress hormone that can be affected by blood sugar, or we can think about chemical, emotional, and physiological stress, or infectious stress to the adrenals. If your adrenals are fluctuating wildly throughout the day, it's going to cause problems in terms of how you feel, pain and fatigue, okay? Your adrenal gland should produce cortisol, which should be high in the morning, which wakes you up in the morning, and then goes down throughout the afternoon, and then by evening it should drop down so you can actually go to bed. Okay? So if your adrenal function is not functioning at its optimal, it can affect sleep, and sleep will affect fatigue and brain fog and so forth. So it's crucial to get the adrenals aligned. Again, proper testing. You have to be able to properly test the adrenal glands in order to determine, are we in a fight or flight state? Are we on what we call the flat line, adrenal fatigue, right? We have to identify those things in order to properly manage those cases. Number 4 is thyroid. Now, thyroid is a pretty hot topic, and we take care of a lot of thyroid patients in our office. And we treat thyroid patients much like we treat fibromyalgia patients. Why? Because thyroid drives the cellular rate or metabolic rate. Your thyroid maintains your temperature, it maintains your physiology in terms of how much energy it's going to produce. But oftentimes the thyroid is attacked by your own immune system. It's called Hashimoto's thyroiditis. It's an autoimmune disease, and it's the #1 cause for under-functioning thyroid here in the United States. Okay? So autoimmune disease needs to be managed, right? And I told you, a lot of the GI system holds your immune cells. So if you have a poor GI system, it will indefinitely affect the thyroid, because the thyroid needs the proper nutrients, 1, and 2, it needs a proper immune function so it doesn't attack its own tissue, right? So your body can dysregulate and attack its own tissue, especially the thyroid gland. Estrogen surges, stress, foods can affect thyroid, as well as liver and gut dysfunction. So in order to manage thyroid, it's the same thing. You gotta run the proper tests. Okay? Anemia, number 5, right? Anemia is basically you're not getting enough oxygen to the tissues, right? You have iron deficiency anemia, megaloblastic anemia, pernicious anemia. Sometimes just B12 itself will help anemic conditions. So you have to drive enough oxygen to your tissues so you don't have the fatigue and you don't have the muscle pain of fibromyalgia. Number 6, chronic inflammation. What causes chronic inflammation, right? It can be thyroid problems, it can be anemia, it can be adrenal issues, it could be a trauma, it could be an infection. Infection is big. I find a lot of GI issues with infection in the GI tract, okay? Sometimes undetected Lyme disease can create global inflammation. Mold, fungal, right? If your house is wet, your basement is wet, and you have mold damage, right, and you're tired all the time, and you get sinus infections, that means you have chronic infection, maybe caused by mold or fungal, okay? Number 7, autoimmune disease. Now, autoimmune disease is much like Hashimoto's thyroiditis, right, which is an autoimmune disease. So any process that attacks tissue, rheumatoid arthritis may affect the joints, psoriatic arthritis might affect the skin, right, or Crohn's disease, GI tract. If your body is attacking your own tissue, you have to ask why. You have to understand the underlying mechanisms as to why it's attacking its own tissue. Sure, your familial, hereditary things will also play into that, but there's often a trigger, right? And usually the triggers are food, it can be chemicals, it can be heavy metals, it can be undetected inflammation due to infection, it can be blood sugar, anemia, right? You get my point. The 9 things that I mentioned for fibromyalgia, they all play into each other. They all interconnect. So it's a problem if you have one of those steps missing or out of order, okay? Number 8 is poor mitochondrial function. What drives the cell is the mitochondria, an organelle in the cell that produces something called ATP. It has to be provided with the right nutrients for it to produce ATP. If you do not have the proper nutrients, or you're malabsorbing in your GI tract and you can't get the nutrients to the cells, you're going to produce less ATP. If you produce less ATP, you're going to be tired. Okay? Oftentimes statin medications, the cholesterol-lowering medications, will reduce a nutrient called CoQ10. CoQ10 is an important nutrient for mitochondrial function. So if you have muscle pain and you're on a statin, you should go back to your primary and say, hey, listen, I don't know why my legs are very sore and it's very weak, right? If you're on a statin medication, you need to look into that, all right? And last but not least is hormonal imbalance. Again, we like to take care of other priorities before we do hormone balancing. Hormone balancing is reserved for our last step because if you can fix blood sugar, sometimes your hormones will balance better. So we don't want to give hormones right at the beginning of treatment, or bioidentical hormones, right? Or even natural hormones like yam extract. You do not want to do that. You want to be able to manage priorities first, figure out what's going on. Right? Most doctors, or good doctors, should sit down with you for a consultation. And during the consultation, they can decipher which pathway might be off. And then, according to that consultation, decipher which tests need to be run. Oftentimes, the test is a confirmation of what the doctor is thinking. So in the old days, the doctor was a good clinician. They sat and listened to what the patient had to say, and then come up with a plan. Right? Oftentimes, in this insurance model of healthcare, everyone's in a rush. Right? You get 5 minutes with the primary, you got 15 minutes with the primary care physician, and how are they supposed to figure out what's going on with you when you've been sick for 5, 6, 7, 8 years? Right? And sometimes it's not the primary's fault. Right? They have to see, 3, 4, 5 patients in an hour in order to run a practice. So sometimes it's just a matter of being able to survive in this insurance-based model. Right? In our office, we actually don't take insurance for these types of cases because it's a very time-intensive consultation as well as follow-ups and treatment. So we actually don't take insurance for that. We have to find the underlying cause. Right? My point is, if you have fibromyalgia, you have to look at all these different priorities, right? Gut dysfunction, blood sugar dysregulation, thyroid function, adrenal function, anemia, chronic inflammation, autoimmune disease, poor mitochondrial function, and hormonal imbalance. You have to look at that, but you also have to have the proper testing and proper consultation. Without it, you're shooting in the dark. So whenever someone goes and they go, oh yeah, I went to some natural doctor and they told me to take all these supplements, which can be fine, which can be good, but sometimes you need to properly test, because if you have anemia and you suspect anemia as a clinician, you have to say, is it an iron deficiency anemia, right? Is it a pernicious anemia? Is it a B12 anemia? You have to figure that out in order to really target into where you want to give a patient a supplement. Okay, so you have to do the proper testing. Proper consultation, proper testing will get you to where you need to much faster, rather than going from doctor to doctor to doctor over 3 to 4 or 5 years. You know, oftentimes we see patients who've been to the best of the best. They've seen all the doctors, they've seen the specialists, but the specialists are very compartmentalized, right? If you go to a GI specialist, they're just looking at the GI tract. They don't make any correlation between GI and brain. If you go to a neurologist, they're not gonna, think about anything else. They're gonna think about maybe running an MRI or an NCV, EMG testing, but they don't make the correlation of muscle pain to the brain. Or if you have depression and anxiety and you go to a psychiatrist, they don't make that connection between food and depression or anxiety, right? We don't treat anxiety and depression in our office, but oftentimes the anxiety and depression will lift if we put in the protocols necessary for the body to heal, okay? So it's important to get to the root cause, do the proper testing, proper consultation to figure out what's going on with you, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And go ahead and like the page so you can get future videos. And we'll see you next Tuesday on the healthy side. Have a great day.